The world is going through a deadly pandemic. Nobody seems to have an answer to it. And the frontline fighters in this are medical and health personnel, doctors as well as paramedics, technicians. And this has now spared no part of healthcare in the whole world. India has a unique situation. In India, healthcare is public as well as private. So, private healthcare in India, the pioneer of pioneers is Dr. Prathap Reddy, who founded the Apollo hospital system a long time back. And this is now among the largest healthcare hospital, private hospital systems in the whole world, barring maybe a few countries like the US, etc. So we are very fortunate to have Dr. Prathap Reddy himself, the patriarch, not just of the Reddy family, but also of the healthcare enterprise in India. So Dr. Reddy, you've seen a lot in your life. I think when you were looking ahead 20 years ago, you were expecting something else in the second decade of the new millennium, something entirely different. That happened, but something else came to overwhelm it now.
Exactly. So, second, first, I'm very happy that I'm talking to a person who has made many social and business things converted into what more India can do to the advantage of the nation. So I warmly appreciate what you have done over the past several years.
Thank you very much.
Today, I would like to share with you, because this 22nd decade of the 20th century, both UN, World Economic Forum, and WHO, they've all said that there's going to be a tremendous crisis in healthcare because of a disease called NCD, non-communicable diseases.
That is like
diabetes, heart attack, strokes, and cancer infections. And this is the warning. There was also another saying, healthcare will have three major advantages. How we practice healthcare. Number one, artificial intelligence. Number two, automation. Number three, robotics. So we have concentrated last 6 months to bring in artificial intelligence, how we can improve the way we can manage patients, how we can manage the information systems within us, how can we increase the automation in all our surgical and medical care, and finally the robotics. The robotics we started, we not only do the conventional robotics like the kidneys and liver and other things, well, we now started even robotic heart surgery, almost first time in the world, or along with the rest of the world. So I think these are good points that was happening. So we were all working towards the angle. Actually, we were about to launch a day when the corporates and the doctors were going to be called and saying, hey, we are going to have this huge threat from NCDs. What can we all do together? What are the things that we can do, 1, 2, 3, 4, and how do you control them? How do you treat them? How do you eliminate them? Like, for example, cancer, previously it was a death sentence. Now, right. One of our conferences, we called it cancer conquerable. Today, I call it cancer curable. In my village, for 60,000 people, there's no cancer. There's no death. We detect at stage 1, 2, and operate it. So I think we are preparing ourselves, and suddenly, by God, after we announced the date, this came saying China has broken out with this, and other countries started threatening over it, from South Korea to Europe to UK, US, and they were in a great mess. And thanks to our government, and that's why one compliment I can boldly give for our government was that lockdown made a significant impact. Leave alone the few major lapses in it, but that lockdown made us realize, saying, here is a disease that's going to hit and it's going to transmit so rapidly, and we need to find a cure
Sir,
for that.
you don't think the lockdown came too early or it was too vast all over the country? Maybe with the benefit of hindsight, we could have first started the lockdown in the big cities.
First, the only way you can contain an infectious disease is to keep people apart.
Right.
So the only way I compliment them for having lockdown was because they contained the infection spreading very fast.
Right.
I give my own household. When just before I went to Hyderabad for 2 weeks, we tested everybody, and there were new servants. I took a few with me, and new servants came. By the time I came back, all 9 were positive. So just one person has brought all this disease and given it to them.
Right.
So I think this is how it spreads. So I think lockdown was a very wonderful thing. But as I said, when lockdown was done, there were some other things which spoiled the whole thing. Migrants, the way they moved in, the way they mass movement, all of these has spoiled the whole thing. Otherwise, if it was a lockdown and people who stayed separate and stayed at home, probably the disease would have been much less.
Much less. So,
and I think that also shows the growth of our disease also is because of lockdown. It is not as
rapid
as the rest of the world. Please.
Sir, sorry to interrupt you. Yes, go ahead, sir.
Don't say Sir Reddy. Dr. Reddy.
Okay, Dr. Reddy. It's just that, it just comes out of respect, but Dr. Reddy, sir. When do you think will India reach its peak? Because you must be talking to epidemiologists. You also employ people in your group who understand these things. When do you see the peak coming in India?
I'm sorry, I didn't get that.
When do you see the peak of the pandemic in India?
I think there are several speculations, and the true verdict is going to be, how do we manage this? How do we manage more lockdowns or more ways of containing people, and then making people observe the 3 principles of not getting infected. So I think as long as we do that, we can postpone this. But one day we want it to peak and flatten. And that's the day when we should say, wow, my God, we have done something. Because there are a few things that India should be proud of. Because our mortality rate is much lower than the rest of the world.
Right.
They're talking in terms of 8, we're talking in terms of less than 3. And in some of the places, it's less than 2. So I think there are plus points, there are minus points. But I think what is required is, this is a terrible, unexpected, major crisis that has hit the world. So and also we did not have the wherewithal. With all other things, we had medicines to cure. There was no medicine. There was no testing kits in the beginning. But fortunately today, at least the testing kits have come in. They've rapidly improved. There is no question of false positives, or so now tests are much more brings us to the point where the patient has or has not got the infection, and some drugs are available. I don't know if this is the best, but at least in our clinical trials, these two are acting. I remember a 96-year-old who got discharged 3 days back. In him, who used both remdesivir as well as the steroid, low dose of steroid. He went home. So,
was he on ventilator?
Yeah, he was on ventilator.
So,
sir, he was very sick. Considering his age, and he was a diabetic, so all of it contributed to all of these. But fortunately, he responded to the treatment, and nice to see him go home.
Sir, your own hospitals, what kind of recovery rates and what kind of mortality rates are you seeing now?
See, we have a advantage and a disadvantage. Our major disadvantage is, unfortunately, they go to some place when the patient becomes very severe. They say that time shift him to Apollo.
Right.
In the ambulance, the time taken and all of it aggravates the patient. So these patients, we have a bad time. But if the patient has come to us, we have what is called the Kavach. In Kavach, we have divided immediately. The patient comes, saying, these are the following things that we would like to do. If you are suspected of this, we isolate him. We isolate him at home, or we have several hotels across the nation where we put them there and start testing them. If the tests are negative, and if they're feeling better, we send them home saying it's a bit of a weakness and probably a mild fever. It has nothing to do with COVID, and they go home. If it is COVID, and if they start developing symptoms, we bring them to the hospital, what's called Section A. It is not intensive care. Section A, where the medical treatment is given with greater observation. From here, nearly 90% go away home. They don't need intensive care.
Right.
But in advanced age, and if they have other comorbidity, because most of the patients that are coming to us are our patients from previous illness. You know, they are transplant with us, they had a kidney transplant, heart transplant, or renal, and they are in immunotherapy, or they are in anti-rejection factors. For those people, the risk is higher. So they need intensive care. Or if they have come late also, they need intensive care. When they go into intensive care, our results are perhaps close to 93, 94%. We lose about 6-7% from the ICUs.
From ICU. So
I think in all we feel our morbidity. If we don't leave away those people who come already almost gone in the admission itself, it's still better. But the country also, we are proud. The country's rate is 3.2.
That's
so
right.
I think as we are learning it when there was no medicine, I'm sure with these medicines acting, probably newer medicines and better acting medicines will come. And then I think the results will be much better. So that I feel glad as a doctor and a doctor's day to say, I'm proud Indian doctors, Indian health system is good.
Oh, that's very reassuring, and I like the smile on your face. That's a smile of satisfaction and I'd say pride. Now, has the Apollo system developed a protocol for COVID treatment for people who go into serious sickness?
People?
Has the Apollo system developed a standard protocol for those who might have the serious version of the disease of COVID?
We have the total system. That is what's called the Kavach.
Right.
We developed this program. We have given it to all the corporates, for all the societies, and for people. It's easily available. So we tell them what all need to do from the time they suspect that they have a problem, or to avoid the problem, number one. And when they suspect that they have a problem, what they need to do. And when they get symptoms, what to do. And then when they come into hospitals, how we manage them. First, we have fever clinics. So the fever clinic will eliminate, or they will do the tests on them to find out if it is ordinary flu or any other temporary fever, or is it from corona. So, but this will help us. And then in all hospitals, we have a good critical care system, because we have already treated major cases. So our intensive care units and critical care units have always has the best technology and infrastructure, and the trained doctors and nurses and staff. This is very important. I think this is where we are going to, when the disease burden further increase, the country is going to have a problem with this, because they also get infected.
Right.
You know, when they are doing their work, some of them are getting infected, and then they will have to lay them off, And to get more people, people are getting afraid. So it's not much now. I'm just saying there is a possibility. This is where we prepare ourselves. So we're trying to see how can we recruit and train more and more people on intensive care. Previously, we were doing, as the cases were increasing, we increased it by 5%, 10%, that was enough. But I think now what we need to do is to be able to multiply month on month the number of staff to deal with intensive care patients. It is possible because India has and India needs. So I say India has, but I really should say India needs to double its doctors, triple its nurses, and quadruple its paramedics. We have the facility to do it, but we are not doing it.
Can I repeat, sir? Double its doctors,
Double the doctors,
triple its
triple
nurses,
the nurses,
and
quadruple the paramedics.
Right.
And this is the only country where young people are there. So we not only can support our country, we could become a major healthcare supporter for the rest of the world. Today, NHS, originally it had 55% Indians. Even today, there are more than 40% Indians. If Indians walk out of UK, their NHS will become very, very sad. And they want more nurses from India now. Europe wants now 20, 30,000 nurses. Everywhere around the world. Previously, Philippines used to give. Even now they will give, but they will give in few thousands. But India is capable of giving 10,000, 20,000, 50,000 if you train them. So that's a huge opportunity we are missing. I think this government has increased the doctors. Nurses also, they have taken from 50 to 75 to 100. I said, if you are training 250 doctors, you must train at least 250 nurses. Straight away, you have 2.5 times, you will improve that number of nurses. So there are many things that we can do first for ourselves, so that we are never inadequate to if a problem like this arises, a huge crisis comes like this, because nobody expected it. And they are not talking about reinfection, the same disease. When it's reinfection, and it's continuously moderating itself.
Right.
So its characteristics are changing. So we might have increased difficulty. So we need healthcare people. We need healthcare people, both in the private and the public health sector.
So, sir, Dr. Reddy, if I may ask you, do you have a count of how many of your staff have got infected with COVID, and how have they done with their treatment?
See, there are two ways our people are getting infected. First of all, they all don't stay with us.
Right.
Almost all the nurses, 90% of the nurses stay with us. So we look after them, surely none of them get infected. But now, when we are treating COVID patients, we put an iron curtain. The people who treat COVID patients, they stay separately. They work, they go and relax for 5 days. 5 days if they work, 5 days they relax, they come back. They don't mix with other staff. So there's really an iron curtain between the COVID patient and ordinary patient. This is why I said Apollo is a safe hospital, because people are hiding their other diseases, heart attacks, stroke, cancer. This is all growing because they're afraid to come to hospitals. So this is why I'm trying to tell them Apollo is safe for you, because our doctors, our nurses, our other staff are also working in the hospital because we have made it safe for them.
Dr. Reddy, how many of your staff members so far have turned COVID positive?
In the COVID ward, we have 41 people who got infected.
All over the country?
From all over the country.
I see. And have all recovered all right?
All well. By God's grace, we didn't lose anyone. 41 who got cured, I'm sorry. Total number is about 120. 41 got cured. Others are cured and under rest.
I see.
But we have another equal number, 140 people, who got infected in the community.
Right.
So they have not worked in COVID wards, but they are in the hospital.
Right.
So we're very careful about them and seeing every day we check their temperature and they go to the same rigor, saying you have any weakness, you have any cough, you have any throat pain, you have got fever. All of this they go through every single day. Fortunately, a robot does it, so they're happy.
Right.
If a person is talking to them, they might feel bad. But when a robot is talking, they laugh and answer.
So this is a new one, that a robot has a better human touch than human beings at this point.
At this point, yeah.
So what do you tell a COVID patient when you give somebody a report saying you are COVID positive? What do you tell that patient? When you look that patient in the eye, what do you tell that patient?
Fortunately, Apollo probably, this division of infectious disease doctors was not there 15 years ago. So with great difficulty, I got 2-3 people. Today, the Apollo has about 10 to 15 ID doctors. Other hospitals also have. And the postgraduate degree is also there in infectious disease. We leave it to that doctor. He immediately says, these are your symptoms. I don't think you need to be worried about it. You get isolated first. Isolation can be at his home, or we have hotels across the group. On all of our cities, we have hotels where we keep them. But there are doctors, there are nurses, there are testing points, and telemedicine, so which the doctor follows. Is there any symptoms which require immediately shifted to another hospital? And then if there's a small number turn into criticality, at that time we'll have to shift him to intensive care unit.
So in every major city you have taken hotels now?
Yes. Wherever there's 24 places where we are, there are hotels. Most of them, they're given us at a very reasonable rates.
Right. So say Delhi.
I think we need now. We got 2 hotels in Madras that's full yesterday. Today they're finalizing another hotel.
I see. And what about Delhi, Hyderabad? Do you have hotels there?
But
in Delhi, in Hyderabad,
in Delhi, we have two hotels in Delhi.
Which ones? Would you remember which ones?
I forgot the name. First, they gave the Sun,
yes.
And they went to court.
Right.
So they gave us 2 other hotels. We kept our people, and it's working.
It's working. That's excellent because that increases capacity.
Yes.
Dr. Reddy, I have a question from YP Rajesh, who's our managing editor, and he's coming to the key question. He says, does India need more private corporate hospitals or government healthcare to tackle its burden?
Sorry, I didn't get the question right.
The question is, does India need more private healthcare or private hospitals or government healthcare to tackle its burden? Because India has a huge burden.
Yeah. See, we have about 2/3 of our patients, thanks to the reform that was brought in the early 80s, about 2/3 of our people today have the benefit of using the private healthcare in all means. It's not just treating fevers and pains, but whatever is happening anywhere in the world. I'm a cardiologist. I started it because of heart. Today, I proudly say that we are number 1 in the world. We have done more than 190,000 cardiac surgeries, and we do the minimal cardiac surgery cases. That again, we are number in the world. And today, we are also doing robotic cardiac surgery. So whatever is happening in the world, we are not behind. That is because in India, as I'm proud to say, our skills and our intelligence is second to none. Because all of us are worth the same amount. Shekhar's body is worth $6,000 trillion. Dr. Reddy's body also $6,000 trillion. Probably 10,000 rupees less than you. So we have that intelligence, but fortunately, The Indians, whatever our previous systems were able to use the various neurons. The normal human being uses less than 5% of his brain capability.
Right.
The person who does more than 10% is called intelligent. So I think where that only thing, as I said, I give Japan number one because they've got intelligence, they've got the focus. So if we focus, we could be easily the number one in the world. So in whatever we are focused, we are second to none. In healthcare, I can tell you easily, in everything, I remember we started transplant well after all the American hospitals and Europe hospitals did. When I went to Mayo Clinic, they gave me a bunch of flowers and said, Dr. Reddy, this is for you for overtaking us after 21 years. Today, we are far ahead in the transplants, and our outcomes are better. Our care compassion, as I said, is our specialty, and our costs are 1/5 or 1/10 of the cost. So this is where I feel proud as an Indian doctor on a doctor's day.
Yes, absolutely. And that's a good day for us to have this conversation. So the question still is that a poor country like India, should it invest more in government or public sector or public healthcare, or should it invest more in private healthcare? And is there a contradiction between the two?
I think the people who can afford should increase. So I think more and more people, or almost everybody, to take an insurance. The 2/3 of Indian population should take an adequate insurance for them and their family. Today, only 20% of them who can afford are taking insurance, and when it comes to illness, then they are paying out through their pocket. And once in a way, if he becomes broke, all the media will criticize us. You know, he went to a private hospital, he became broke. But if he has taken an insurance, nothing would have happened. But similarly, as far as the public expenditure is concerned, I think we are very, very, very low compared to the rest of the world.
Very low.
US is spending 17%. We are spending 1 to 1.25% now. Our request was make it 3%, let the private spend 7%, will be 10%, equal to the other middle-income countries. Then we have a safe thing. We could talk then about spending some money on prevention.
Do we have a shortage of, you said we need more of doctors, nurses. Why are we short? Why is there an undersupply of medical education in India?
Because I think the systems were very, very, very tough. The present government has scrapped that and formed a new thing called the Medical Council, National Medical Council. So they have increased the doctors, this one. I'm pleading now saying the nurses also must get the same number, 250. So you automatically increase 2.5 times the number of nurses. Start more medical colleges. I have a very typical example. The government referred it in the parliament for a medical college in Chittor, my native district. I took the government allowed me to take the district hospital. It had about supposed to be having 300 beds. There are about 35 cots and about nearly 100 patients in. Today, it is 750 beds, 600 patients all the time. It is treating about 50 to 70 COVID patients at any given time. It has all the features. So this could be the model for them. And I think in the parliament they talked about it. If they upgrade all the 600 district hospitals by spending maybe 20 crores each, they will have, it no longer can say only the metros can get good health care. The villages can get good health care. I have a hospital in my village, 60-bed hospital. In the name of my father, I put that. They have done 250 knee replacements.
Right.
Our doctors went from here, and what a great thing to see. The old people saying, my grandsons used to tease me, I can't catch the guy. Today I can run after him. I think these are the things that a few understanding, it is not complaining. Few understanding between private and public together can make the country more vibrant in our health. And it's good for you and me is good for people all around us.
So there are, at the same time, there is a strong feeling among lots of people that private healthcare indulges in profiteering. So in fact, people would go to the extent of saying nationalize it. People would go to the extent of saying nationalize it because private healthcare indulges in profiteering.
You know, I don't know why. There are so many other industries in the world, hotels, shops, many other industries. They never talk about its profit or loss. And whereas in healthcare, if one bill out of, if I treat 1 million, suppose one bill is say 30 lakhs or 40 lakhs rupees, automatically they flash. They don't want to find out what is the margin the hospital has. Our margins is published. Ours is a public limited company. You should, and most of the hospitals today, all their accounts are freely available because they're submitting it. So when you do that, our aim is to make between 15 to 18%, so that we can give 8% to the investors, 8% we can reinvest. From one hospital today, I now have 72 hospitals, including a major cancer treatment called Proton Hospital, which cost me about 1,500 crores, one of the best in the world. It's not my saying. There's a patient who went to Mayo for his cancer treatment, and he saw in the social page Apollo, he spoke to our doctors and then told them, suppose I come to Chennai, when will you give me an appointment? So the doctor said, you come after 3 days, we'll give you an appointment. He came immediately at his treatment, and his wife said, I had my surgery in London for my breast. My husband, we went to Mayo. Now we came and had treatment with you. Dr. Reddy, believe me, your hospital is a super hospital. I was there 3 days ago. Again, I met patients. In the beginning, before the lockdown, about 40% were foreign patients. But because of lockdown, even difficult other state patients also are coming through, on the flights, emergency flights. But that is my pride, that we not only have this number of hospitals, all our hospitals are equivalent, and most of the departments, I can very happily say that we are as good as the best hospitals anywhere in the world. I think this is not my credit. This is Indians' credit. I believed it at that time. I told then Prime Minister, and she said, how can you do it in India? I said, who Indians are doing outside?
Right. So Dr. Reddy, I have two questions which are linked from my colleagues, Himani Chandna, who covers pharma and health sector, also Avantika Ghosh, who also covers the health sector. So they are asking, one, that there is a perception that private hospitals are reluctant to admit more COVID patients, are allocating too few beds. And the follow-up question is that government is now mandating the number of beds that private hospitals have to give for COVID and also fixing the price. What is your view on both questions?
This quota system doesn't belong to this. If you want to treat patients, if I say I'm giving 100 beds, I should be able to have at least 15 critical care beds. So that is the manner in which they should allot. They're not first, they said, we don't want you. We don't want you to do the tests also, some states.
Right.
Then suddenly they said, now they're saying you do 60% of the patients should be COVID patients. What is that 60%? 60%, I should be able to do people whom I can treat to the last minute. If they get symptoms, cure the symptoms. If they're critical, bring them out of the criticality. So that is how it should be allotted. And as I said, by numbers we are taking, because we invented this system of hotels. So, people without symptoms, I'm keeping them there. So if you count all this, I've got 3,000 beds. which
Right.
I'm giving.
Right.
But
So,
critical patients,
right.
probably I have about 200, 250 patients in all over the hospital, because I cannot remove all the beds and give it to COVID patient, because other diseases there, heart attacks are there. Only thing, people are scared to come to hospital. On New Year's Eve, we had 14 patients who came with acute MI. On Christmas Eve, 8 people came with acute MI. They are all there. Cancers are growing at the rate of 40%. But unfortunately, they're staying at home. Somebody must tell them. I am trying to tell them, Apollo is safe. Please come. We'll give you the same treatment, and we will assure you that there is an iron curtain between COVID patients and non-COVID patients, so we will not infect you.
So, Dr. Reddy, how have the bottom lines been affected now for private hospitals because of COVID?
Because of immediate this one, it got badly affected. We got, affected 60%. But I feel more sad for the small hospitals and the so-called nursing homes. For them, some of them became absolutely broke. But nobody, even in a health crisis, they are not talking about helping healthcare. I wish those hospitals are given an X amount, or I should be also given if necessary. Say, Dr. Reddy, that's available for you. You can take a loan, pay it after 5 years. Because I must continue to do service. Because now I've told all my people, we have 100% of our old commitment, plus this new commitment. So we must work 125%. This is the oath that I have taken, and doctors, the message which I have sent them was all about this. That we have no way that we will get away from our previous responsibility of managing all the NCD patients plus medical and surgical emergencies. In addition, we have to treat this.
Right.
So it's a 120% burden that we must bear. But the people must come to us. They're scared.
Yes, because I must say that I am scared of going to the path lab for my routine tests, because I don't know. I just think that everything has virus floating there.
Yeah.
That is the human tendency. Dr. Reddy, do you have a view on price controls? Now there are price controls for testing for COVID, price control for treating COVID, ICU prices also for COVID. But
first I say I accept. But there should not be a rule only for healthcare and nothing for all other healthcare. A cup of coffee on the roadside is 1 rupee. In a 3-star hotel, it's 5 rupees. In a 5-star, it's 150. Nobody questions this.
Right.
So what I'm saying is, in a nursing home, a next treatment will cost 10,000. But when I come to tertiary and quaternary care hospital, our cost is 30,000, 30 rupees. But they equate the same thing. I remember I was told once our Prime Minister saying, our doctor after 35 years, 25 years and 10 years experience, if he sees 15 patients of your CGHS, his take-home pay is less than a lower division clerk. So immediately call the cabinet secretary to do something about it. They called a bid, and in government they have always got this L1. So the L1 again was worse than previous one. Whereas all our expenses are growing for the last 15 years. But our tariffs of CGH is the same what it was 10 years ago. Our administrative expenses have gone up because we must pay minimal prices. Everything now, you saw the petrol and diesel going up every day. So like that, everything else goes up, and we have to pay more for them because they have to live. So instead of giving them 8%, we are now giving them 14%. So all of it is, so I think there should be a reasonability saying this is what is necessary, because they fixed everything before in the planning commission. If you lay roads, this is the percentage you should get. So they called us too. I said, please give us 12 to 15% above our cost. 50% of it we'll give it to the investors. 50% will give it to for development. If I did not have it, how could I have all these hospitals?
So, Dr.
I should not stop. If I get broke, I can't do any more hospitals.
So,
But I
Dr.
think we need many more hospitals because we need to build another 100,000 beds each every year to meet this increasing burden.
Right. So, there are price controls in other areas also that Modi government has brought in. For example, in implants, knee implants, stents, so many areas. Do you think those price controls are a good idea or not a good idea?
It should be more reasonable. And there should be a quality difference. There should be a quality of cost. You can't, the two tablets of, say, of aspirin, both are not the same. For the quality, you must pay 25% more. So I think with that metrics, if they use, it should probably. And in any case, profit is not an offense. It's not a guilt.
Right.
You make profit and use the profit for development. I don't think it's guilt. I don't think by building 70 hospitals out of profit, I'm not feeling guilty.
That's right. But is there a tendency in our politics and public debate to see profit as a crime, as a bad word?
Because healthcare is a very sensitive subject, because it's a sickness. Government wants to do all it can to reduce the prices. So I think it's fair for them to think like that. But I think they should keep, like the previous, for all other things, they fix the tariff or planning commission. But somehow when it came to health, they just could not do this. So I think somewhere along that line, you must use one of those examples and say, even if there are 4 products for a single treatment, that 4 products can't be the same price.
Right.
But in any case, I admire the present government in many ways. As I said, even in COVID, what they have done is remarkable. So I'm not criticizing. I'm just saying that we can do working together, thinking together, we can bring better health. And not only bring better health, take the advantage of health. I'm one of those who have always pleaded saying, Indian doctor is second to none. Our outcomes are second to none. Even today, it is not only Indians using Indian healthcare. About 150 countries, people come to India because of our care, because of our cost. Same advantage if you take the medical tourism industry is a $350 billion industry. See, what did we previously it all used to go to Indonesia. Then Korea took it up, Singapore took it up, Malaysia took it up, then Germany took it up and started promoting it. Who are their promoters? They had a medical tourism department. Apart from that, every single consulate of theirs became their selling point. So especially Korea, who was nowhere in the medical field. Today, they're almost number 1, getting the largest number of tourism. If India does it, rightfully we will get more than 50% of this 350 billion growing thing. So I have pleaded many times previously, we wanted infrastructure status like IT, something like that if it is given, that's one. And advantage is it's not money. If we have that money, because ordinary tourist spends $2,000. India, when it comes to medical, he spends $20,000. In addition, Indian systems of medicine, Ayush, is being practiced in Europe. They go there and pay 2 lakhs, 12 lakhs. Yeah, if they pay 20,000 rupees, they'll get beautiful care for a week. So that also could become additional income. So the importance of traveler, ordinary traveler and medical traveler is a huge impact. And more than anything else, it's a credit for them to say, I got treated in India. So that way India's, that's what the PM is trying to see, that we should become the top 1, 2 in the world. And this could be in medical can take them to that level.
Dr. Reddy, Sandhya Ramesh, who's our science editor based in Bangalore, she wants to know, are your hospitals trying out new drugs apart from the usual hydroxychloroquine, tocilizumab, etc.? And are you trying remdesivir, favipiravir, etc.? And are there any...
I think that, we've been enrolled for 5-6 clinical trials.
I see.
So we are also doing the clinical trials, but we also control on the situation of the patient.
Right.
If the patient condition does not improve, so we're doing clinical trials with sick patients. So we have to be a little more careful than ordinary clinical trials.
Right.
So we do one of the largest clinical trials in any case. But in this, we are doing the clinical trials in 5 or 6 drugs. But I wish to say that we are doing completely. But as I said, it's because of the disease pattern. In critical people, we will have to withdraw.
So, Dr. Reddy, I know that clinical trials take a long time, but are you getting some indications that some of these drugs are working?
Yes, I think definitely this these two drugs which are being used more commonly, small doses of cortisone and the Primavera, is definitely working. And I told you this 96-year-old, we used both, and he went home. But right. Does it work in all? I can't answer. That's why we need to do more and more clinical trials, which we are doing.
Yeah.
And plasma trials we're doing.
Dr. Reddy, you talked about Ayush. Now there's also been this this story about Baba Ramdev's Ayush drug, Coronil, which they claimed they held trials and they said this cures corona. Would you have a view on that?
I don't know. My doctors have asked them so far. They have not tried it so far. So I must depend on my doctor's views. I can't give my personal view, but I take ashwagandha.
You take ashwagandha.
So it doesn't mean that I should use it as a treatment or immunity problem, increasing the immunity of people. But so, scientists must tell us. We have a separate department of scientists who do the clinical trials. They've done several good things. I wish Ayush plays a very major role. I'm now building an Ayush hospital in my village.
I see. So
I have a 60 beds allopathy, but I'm building this also.
So what do you take ashwagandha for? What benefit do you see in ashwagandha?
I said in general it improves the immunity, they said.
I see.
Said if it doesn't do harm, why not take it?
Absolutely.
But I have not proven it. No.
Right. And to claim a cure, you have to prove it in a proper clinical test.
Yeah.
So when did you take your first COVID patients, and what was your staff immediately scared? Oh God, we have to deal with COVID now.
I think it all started because we get patients with fever. So when fever patients come, we started testing them. In one of the patients, they tested him for all illnesses. It all came negative. So he was put as fever unknown origin. And he was getting worse and worse. So that is the time when the news came that in COVID, this is the type of test that need to be done. So that PCR come first, that antibody came, but PCR came. Fortunately, that is the day in March when we did the first, but we had at least by that time maybe 100 fewer patients undiagnosed.
Right.
And this helped us to treat, find out the diagnosis. And we tried, like everybody, we also used, anti-malarial drug for a few days.
Sir, Swagata Yadav, who's my colleague, she wants to know, she says the biggest casualty in privatization of healthcare has been doctor-patient trust. So how do you restore and maintain doctor-patient trust in private healthcare so the patient doesn't think that I'm being given some treatments or drugs or some procedures to up the turnover?
I don't know. I think today it is the other way. The patient knows more about his disease than the doctor. With this, when it rolls over his telephone, that gives him more about his disease than the doctor knows. But as far as we are concerned, we always treat patients with care and compassion, and they always, except maybe 1 in 1,000 who is not satisfied. But most of the patients, we do what we call their happiness index and see where it lacked. Like we do what's called the Apollo clinical excellence parameters. That means what is the success rate in heart disease? What is the success rate in each disease? How do you compare it with the world level? That comes. Even 10 years ago, American Health Secretary came and he saw this book called, he said, I wish we could implement it in US. I'm happy you got such a, that's why however remote village, place where we start, even on first day, their treatment is the same because they follow the same guidelines. I think one of the book we sent you, this Dream, Innovate, Inspire. This is given to every single division of the hospital. So they all follow, and every time they report what's called and it go reviewed by the board for each hospital. So we have a follow-up method and think we give reasonably good medicine. I wish I can say all my patients get the best treatment, but we'll try our best to give the best possible care.
Dr. Reddy, before we let you go, a couple of questions. One, when do you see, because you have so much experience, you have such great instinct, you think a lot, and you read up everything I know. We've had many conversations before, and you also bring in cutting-edge technologies. I remember on my Walk the Talk, once I featured the doctor who had produced the cyber knife for...
Cyber knife.
Yeah.
I told you, today I got the proton, which is 1,200 crores.
Absolutely. So I know that you stay current. So what expectations do you have from a virus, from a vaccine coming up? When do you see the first vaccine, and what kind of vaccine?
I think there are a number of centers which are doing vaccine. Unless our Indian centers do, either Pune, there is something happening in Hyderabad. If they do, and if the cost becomes so low, then only it will become useful for all people. Suppose they produce a vaccine, and if you charge it 10,000 rupees, how many will take it? They are not taking a health checkup for 5,000 rupees.
Right.
How will they take a 10,000 rupees vaccine? I think Poonawalla, I admire them. We cured polio, HIV, all of these. Their vaccines are absolutely throwaway price. We need that because he's doing it on a charitable basis.
In fact, we featured
somebody like that.
We featured him on Off the Cuff also, and he talked about how he is now working with AstraZeneca and Oxford universities and others to produce large volumes of this vaccine.
Yeah. I think it will come. I hope simultaneously India also will produce so that it will be available for a large number of people in the developing and underdeveloped world.
In 1 year or 6 months, sir?
Time, I should say. It's a toss-up.
It's a toss-up.
I wish, like Apollo 13, the time went right. And it was a 1 in a 5 million shot. Somebody put 1 shilling bet in England, and he got that money. I wish I could predict like that. But I think I appreciate several of them are working very hard. Round the clock, they're working to see how can we do it? How can we save people? That intention is there, and the speed with which they are doing also is excellent. So I expect that hopefully within a year we will get it. We need it at least before the reinfection starts. I'm not only afraid of the peak of October, I'm also afraid of what's called the threatening on the repeat of this pandemic.
Although right now we haven't seen reinfections among recovered patients, but we have to be cautious.
Now they've rolled out.
Second question, with all your experience and reading and access to people who know, do you take seriously the idea that this virus may have escaped from a lab?
Seriously?
Do you take seriously the idea that this virus may have escaped from a laboratory? Could this virus have come from a lab, from a laboratory?
Oh, I understand you. Is it a lab virus or a
Yes,
real virus?
yes.
I mean, it baffles us. You know, I have seen in Africa, they had that Ebola virus.
Right.
And it's killing 30% of the patients.
Right.
And the moment the temperature went up, it became normal. In Saudi Arabia, they had a Merck virus from camel. One night I got a call from the health minister. Immediately I sent a team. The team said there are no process protocols in the intensive care unit. I sent another team that night, 7 people. They went, they set up the process protocol, and in 5 days, the death stopped. But death stopped not because of only us. The temperature also went up to 30. But here, it is killing people in winter. It's killing people in summer. So it's a different virus, which I think we need to watch and more carefully. But I cannot speculate that it came from the lab.
But
all that I can say is, and it's metamorphosing so fast. So it is not an ordinary virus.
It's not an ordinary virus. So would you say that you can't rule out the possibility that it's a lab virus?
As I said, I won't commit myself to say that because I have no proof to say it. All that I am saying is this virus is acting very aggressively and defying the normal features, in winters and this summers. All other viruses either lived or died. And it's also changing the morphology very frequently. So I think it's a serious one. I wouldn't say that definitely that it is a lab virus.
So that is the other mystery. How have the Chinese come to grips with it so quickly? Such a large population there also.
I think that makes us also realize there is something to it because except that region, Wuhan, it did not spread to other areas of China.
Right.
Why it has spread to every village, including my village? Last week there were 21 cases in my district.
So how is it possible in China that it's not spreading?
I said that's some secrecy which they have not given to the world.
So there might be something that they know that they haven't told the world.
I must think because none of the other parts of China got it, whereas they are world everywhere. North America, South America, South Africa. No country is spared. No district is spared. Even so-called in India, a few districts were spared. They are also slowly spreading.
So should we all be requesting the Chinese government now to share it with the rest of the world?
I wish they are that large-hearted. They should care for humanity.
Right.
I tell you, they don't have to give the medicine, but if they tell how they could control the rest of the thing, I think it would have been very helpful.
It would be very helpful. So that's a very good note to conclude this on. But before that, do you have a concluding message for people watching this Because everybody is scared right now.
I think first I must tell them there is no use getting panic because panic does not cure. It only lowers your resistance to disease. It's very clearly told how to avoid the disease. Safe distance, stay at home, use mask, cover with if somebody is sneezing. All of these very well known to everybody. So I think that should console them that they are safe. And then my other fear is they are not caring for other diseases, which are very severe. The heart attacks are very severe. They are not coming in time. Some are dropping dead at home. Cancers are growing from stage 1 to stage 2, stage 2 to 3, 4. So I think then similarly, the diabetes, what stage that is, because the fear, we know diabetes increases, the levels go up, sugar levels go up. When sugar levels go up, all our organs get affected. So I think my advice for people is, yes, you want to be cautious. Don't panic now. That panic stage is over because we understand the disease. We understand how to manage the disease, but look after yourself. Because if you are safe, the disease, even if it affects you, still you will come out safe. But if you are not safe, that your comorbidity is not taken care of, I think your risk is greater ordinarily, and with virus it's much greater. So I think it's very, very important that they should care like before to take that, go back to the doctor, get their test done, and control all the other diseases a little more than what they did before, because that will help them to get rid of any severity in this COVID.
So, Dr. Reddy, do we see your group going into medical education more?
I think always we did. We had the postgraduates, the largest number of postgraduates. We have more than 1,000 postgraduates whom we trained as super doctors, and some of them are super specialists with us. But we also have 2 undergrad colleges now, one in Hyderabad, second in my native district. In my native district, what I'm doing is, I promised myself, they called me at their 100th year of Chittoor district. I said, I will do here something which at least 20,000, a large number of people will be able to train themselves in some line in healthcare. So I've built the medical college, I've built the nursing colleges, I've built other institutions, but it's yet to go. It's still work in beginning, but I'm happy to see that even the university, hopefully, they'll grant a university status for it so that I can do some innovative courses. We can do research and clinical trials. All of it I have hope, and I've put my own worth, some extent to go to that, so that forever it is not dependent on anyone.
So some of us know you well, and we know your family well, but a lot of the rest of the country doesn't quite know that how you are the patriarch of a bunch of brilliant daughters who run everything for you. So tell us about your daughters in a minute before I let you go.
I think, I said they are also the same human beings, $16 human beings. The way the mother taught them affection and attention, these are the 2 things she taught. So when they came to age, I slowly inducted to them saying, till you find your own business, your own work, try to do something here which is helpful to another human being. I think that's how all 4 got involved. And because they were stretched, their best came out. So they are not superior to anybody. It is because they brought out their best in them, they became so good.
So do they bully you? All daughters bully their fathers.
They get that time. They get that time. Out of work, they get time. In hospital, they don't.
in hospital network. There you follow the hierarchy.
Yeah.
Thank you very much, Dr. Reddy. It's been such a wonderful conversation.
It's a wonderful pleasure, and God bless you in your new avatar and everything that you do. And
thank you very much, and all of you be there. And if India just has undersupply, undercapacity, so India needs more public healthcare, more private healthcare. India needs more of.
We got people. We must build it.
Absolutely.
We should not miss this opportunity, especially now with this challenge.
Terrific.
Thank you.
Dr. Reddy, on that note, all the best to you and all the best to your colleagues and your staff. I hope everybody stays safe and keep doing the good work.
Thank you, Shekhar, Gupta. All the very best to you and your family and your team, your family.